Welcome to the Center of Excellence for Behavioral Health and Nursing Facilities virtual education event. Today's session will cover Mental Health 101. My name is Rukia Campbell, and I am the technical support for today's session. We do have just a few housekeeping items as we get started. The session today is being recorded. All lines are muted, and if you have a question during the session, please place it in the chat. Now, due to this event only being 30 minutes, we will not have a question and answer session today, but if you place your question in the chat, a COE representative will respond to your question. And then again, if you haven't already, please complete the pre-test survey that you see on the screen. And you can also click the link in the chat to also complete the survey. So again, we welcome you to today's Mental Health 101 session. As we near the end of the webinar, there will be a post-test survey that we would like you to complete as well. We thank you in advance for your time and participation. Now I will give the floor to your host, Nikki Harris.
Good afternoon, everyone. I am Nikki Harris, Training and Education Lead for the Center of Excellence, and it is my pleasure to oversee the delivery of mental health and substance use disorder training and education to nursing facilities nationally at no cost to the nursing facilities. Now, I am happy to introduce our presenter for today, Dr. Kennard DuBose. He is the assistant professor at the University of North Carolina, Pembroke, in the Department of Social Work. Dr. DuBose is a licensed social worker and licensed addictions counselor with over 25 years of experience working in the behavioral health profession. Now I am happy to turn it over to Dr. DuBose.
Thank you, Nikki.
You're welcome. Thank you.
So this training, Mental Health 101, is an introductory training to help identify, understand, and respond to signs of mental health disorders. This training will address some of the common causes contributing to the onset of or exacerbation of mental health symptoms among nursing home residents, meaning what may start, what may trigger, or what may worsen different symptoms related to mental health disorders. We will discuss common warning signs and practical strategies of how frontline staff can support improving residents' mental wellness. Additionally, the training will assist nursing facility staff in developing skills to effectively help and support residents with mental health disorders. So our learning objectives. Learning objectives, we will discuss what is considered a mental health disorder. We will discuss the common mental health disorders in nursing facilities. We will discuss common causes contributing to the onset or exacerbation of symptoms. And we will identify common and practical strategies nursing home staff can use to support residents with mental health conditions. So, what is mental health? And why is it important? As we begin our training that will focus on mental health disorders and symptoms, it is first important to establish what is mental health and what it means to be mentally healthy. Now, that is a phrase that we don't often hear. However, when you think about an individual's mental health, what we are referencing is their psychological, emotional, and social well-being impacting a way a person's think, the way they think, the way they feel, behave, and socialize with others. How we handle stress, how we're able to relate to others, and the choices we make that's going to affect our psychological, emotional, and social areas of functioning. There is an individualized baseline that we all establish as it relates to our day-to-day abilities to cope, to express ourselves, and to manage our emotions. And just like our physical health, our mental health is an important aspect of us having holistic wellness and being able to perform in our daily responsibilities. So then let's contrast mental health, what it means to be mental health versus mental illness. As we look at the two comparisons, we see that mental health involves functioning in daily activities, being productive, or feeling like you're productive in the areas such as work, your living community, and being able to maintain healthy relationships, as well as being able to adapt to changes and adversity when it comes your way. Versus mental illness, we begin to see significant changes in our thought process and our emotions, as well as our behaviors, which leads to persistent distress and our problems that begin to impact our daily functioning in our social lives, in our work lives, and with our family activities. So as a result, the individual begin to meet the criteria for a diagnosable mental disorder, and many of your diagnosable mental disorders require a pattern of behavior where there's evidence of distress and our problems in daily activities, such as work, such as your living community, or interaction with family members. So let's look at some common myths and misconceptions about mental health. It's important to address the common myths and misconceptions associated with the stigma of someone having mental health issues. Unfortunately, because of the stigma, a lot of inaccurate information is often circulated that becomes a barrier for people getting the help they need. And such misconceptions and myths are people with mental illness are crazy, which is a derogatory term, not having any therapeutic value, and not used professionally by any folks trained in the field of mental health. Mental illness are extremely rare. When we look at some of the prevalence data with individuals diagnosed with mental illness disorder, we're going to look at some of the prevalence data in just a few minutes, and you'll see that that's also a myth or misconception. People with mental illness cannot function in society, which is also not true. With proper treatment, medication, and support, individuals can learn to manage their symptoms. Mental illness makes people violent, where there are some cases of individuals with mental illness becoming violent. The number is not as high in comparison with violent behavior overall, which we're going to also discuss in a few minutes. And you can't get better if you have a mental illness, again, which is not supported by the data or the research. With proper treatment, medication, and support, again, individuals can learn how to manage their symptoms. So as we look at some of the mental health facts, to combat some of the myths and misconceptions that were just referenced, most people with mental health problems are no more likely to be violent than anyone else. Most people with mental illnesses or mental illness are not violent. We see that percentage ranging between 3 to 5% of violent acts can be attributed to individuals living with a serious mental illness. People with mental health conditions are just as productive as other employees. And people with mental health conditions, they can get better, and many recover completely. And recovery, and when we talk about recovery, we're talking about a process in which people can live, in which they can work, they can learn, and they can participate fully in their communities. So let's look at some common mental health disorders in this country. Beginning with generalized anxiety disorder. Anxiety is a normal human emotion that is often adaptive and is recognized as the anticipation of a potential threat. Individuals with this disorder, they have difficulty returning to baseline and may perceive a threat bigger than it should be, which causes them distress. Major depression disorder is changes in a person's emotional states, often causing cognitive disturbances such as negative thinking, poor concentration, and as a result, they have significant clinical distress in their daily functioning. Bipolar disorder, which is a mood disorder and often characterized as highs and lows, High being the mania, elevation in our mood level, lows being the depression or depressive state. And there's different levels of severity, which you have bipolar 1, which there may be some psychotic features or psychotic episodes, or bipolar 2. Also seeing significant clinical distress affecting an individual's daily functioning. You got substance use disorder, which is a maladaptive pattern of substance use leading to significant clinical impairments of distress. You got schizophrenia, which is considered a debilitating, serious mental condition, mental disorder. This condition often involves distortions in the perception of a person's reality, often causing psychosis and impairment in being able to reason, behave, or speak rationally. And then your neurocognitive disorders, which are physiological conditions affecting brain functioning, where an individual loses the ability to do daily tasks, such as their activities of daily living. Such examples of dementia, delirium, and even Alzheimer's disease, excuse me. So as we look at the past year of prevalence of mental illnesses or mental illness among US adults, and this data comes from SAMHSA, 2021, we see an overall rates based on gender, age, race, and ethnicity, with the highest rates were among females, the age groups 18 to 25, and race and ethnicity, excuse me, are individuals who identify with 2 or more races. So let's talk about most common mental health disorders that we see in nursing homes and nursing facilities. And according to a study published by the National Institute of Health, NIH, between 65 to 90% of nursing home residents have a mental disorder, ranging from common mental health problems such as anxiety and depression to serious mental health illnesses such as schizophrenia and bipolar. And as we look at these disorders in nursing homes, it is significant to note the average age of onset, such as depression. The age of onset is usually between 35 to 40 to have a major depression disorder. Anxiety or general anxiety disorder, the median age is 30 years. However, individuals often start experiencing symptoms much earlier. Bipolar, the average onset age is 25 years of age. And with schizophrenia, the average onset late teens to the early 20s for men, and the late 20s to early 30s for women. So I mentioned this because when we see these different diagnoses in our facilities, or when you see them in your facilities, it's important that we make sure that people are diagnosed properly. And remember that our mental health treatment intervention is only good as our assessment and making sure that we have the proper diagnosis. As you consider the ages of your residents as they present with different symptoms or issues. And as we look at some of the factors leading to that impact individuals' mental health in nursing home facilities, the feeling disconnected from family or community, chronic pain not properly treated or being addressed, decline in mental capacity, grieving the loss of loved ones, the lack of independence, the lack of physical activity, functioning, or mobility, as well as social isolation. So as we are 15 minutes in, let's also talk about activities. What are some good activities that promote good mental health? some participating in group activities such as games, puzzles, staying physically active, using appropriate mobility devices when needed, visiting with friends and family for that social connection, socializing with other nursing home residents when appropriate, and just listening to music and storytelling, and all activities that can promote good mental health. So as we look at some practical strategies, what then becomes our responsibility of at the facility and staff, we need to make sure that we create a training program to ensure that staff at all levels of care understand mental illness, conduct a comprehensive assessment of each resident's mental health needs. And again, remember that your intervention is only going to be as good as your assessment. Provide person-centered care to address specific mental health needs of each resident. Ensure residents receive appropriate mental health services based on the assessments, and allowing nursing home residents to maintain as much independence as possible. So as we talk about treatment, and of course, treatment is going to depend on the types of mental illness and severity that presents with the residents. But treatment modalities or approaches include individual therapy, group therapy, medication management, psychosocial interventions, peer support, and recovery support groups. And it's always best practice, or it's always good for us to become familiar with resources that are offered in the community in order to make appropriate referrals to agencies, organizations that provide these services. So I have some references and resources listed here as it relates to that you can use to do your own continued research, or as you're looking to gather or pull down more information. These references and resources are listed for you. And of course, the Center of Excellence for Behavioral Health and Nursing Facilities also will serve as a primary resource for you. And it's about 18 after. And Ms. Frierson, I'm gonna hand it back over to you.
Thank you so very much, Dr. DeVos, for serving as our facilitator today for the Mental Health 101. We greatly appreciate you for working with us. And to all of our attendees, we thank you so very much for joining us today and taking the time to be a part of the Center of Excellence. We would love to get your feedback. So we have a post test evaluation that has been presented here for you. There is a QR code as well as a link that will be placed in the chat. If you would please be so kind to provide us with your feedback. We do consider that information as we move forward in developing other topics for trainings, and as well as continuing to provide information on Mental Health 101. We want to ensure that we will meet your need. So please complete that post test and evaluation for us. Next slide. Would you like to receive reminders about future COE hosted virtual events through text and notifications? Please find the link in the chat that's made available to you. Today's session will be shared on our website under events for your reference. And if you would like to request a mental health and/or substance use disorder training for your nursing facility at no cost, please visit our website. Again, I said at no cost. If you would like to receive a mental health and/or substance use disorder training for your nursing facility, please visit our website to submit a request. And if you have any ideas or suggestions about future virtual event topics or subject areas, please send that information to us via our website, which you will find here on the slide as well as in our chat. We thank you greatly. And again, please complete the post-evaluation and the information will be uploaded. This session will be uploaded to our website for your reference. So thank you so very much for joining us today. We greatly appreciate your time. And we look forward to working with each and every one of you. So please, if you would like a training, submit a request. Thank you.